Meeting to order the McLean County Board of Health. It's 5:30 on the 10th. Oh, you don't sit down. It's roll call. It's no public comment first. Did you get an email? Okay, we're fine. Roll call.
Roll call?
Okay. Roll call.
Roll call. Okay, Alan Ginsberg.
That's what he usually joins late.
Okay. Andrew Held.
I'm not here.
Carla Pohl.
Here.
Corey Tilo.
Here.
Anna Eisner.
Here.
Judy Buchanan.
Here.
Richard Janetti.
He's not here.
Robert Kohlhase.
Here.
Scott Hume.
Oh, that's Kathy.
Sonia Reese.
Here.
Okay.
Susan Schaefer.
Here.
And everybody, this is Hannah. She's filling in for Amy. Okay. Don't go anywhere.
Turn to the side.
Do I hear a motion to approve the minutes from January 13th? Sonia, so moved. Any second? Second for, sorry, Hannah. I was distracted. Does anybody have any discussion or any corrections?
Okay. So, to approve the minutes, Corey Tilo.
It's Tello, and yes.
Hello, I'm sorry.
Okay, that's okay. Yes, I approve.
Carla.
Yes.
Pohl. Hannah Eisner.
Yes.
Judy Buchanan.
Yes.
Robert Kohlhase.
Yes.
And Susan Schaefer.
Yes.
And Scott Hume has joined us, Hannah.
Okay.
Busy.
Can I ask him about if he approved them?
Sure. Scott, do you have a vote for the approval of the minutes?
He's on mute.
He must be joining. Are you joining by, no, not by phone. Sometimes he has a lot of trouble with his computer, so. Was he chatting with you, Bob? Is that why you know
I
he's
just
here?
see his name on our screen.
Am I asleep at the wheel? I don't see.
SH, he's there.
Okay, no, I believe you guys. I'm just like, I'm gonna say it.
Yeah.
Oh, okay. All right, so motion carries. Our next agenda item is the consent agenda, which is there for you to look at. Do I hear a motion? Susan, second.
First.
Any discussion? All right, same process. I don't know, what was I doing, Scott?
Carla Pohl.
Yes.
Corey Tello.
Yes.
Anna Eisner.
Yes.
Robert Kohlhase.
Yes.
And Scott Hume.
Give him.
He showed up again, but still not connected, Scott. We can't hear you.
We can't hear you, Scott.
I'll just text him. Hopefully he'll see it.
No, I don't need to ask Susan or Judy, right?
Yes,
We do.
everybody, yeah, the same people that you just, the same role every time.
Okay. And Judy?
Yes.
Okay. Susan Schaefer?
Yes.
Sonia Reese?
Yes.
Oh, shoot, I know what I forgot to do.
Okay.
Right, you're good. We won't need you for.
Thank you.
So I want to just take a minute to have a moment of silence in honor of the citizens of McLean County who have passed due to COVID-19. So if we could just take a minute. Thank you. I think all of our hearts go out to people who've lost family members during this last year and a half. The first informational item is the health promotion organizational chart. Are you going to go over it, or?
Any questions?
It's in your packet. Does anyone have any questions? It's showing the reorganization of the health promotion section before and after the change in FTEs.
And this is what we discussed last meeting, correct?
Yes, sir. Looks like this. Yes, Hannah.
I don't have any questions. I just wanted to thank Jessica for doing that. It was very helpful. So appreciate it.
Anyone else have comments or questions?
And the new public affairs person is on, and I'm hearing good comments, good presentation. So that person is here. Tell them to take a bow.
She is here.
She is here. That reminded me that we need to introduce her.
Well,
We
thank you.
need to introduce her, yeah. She did a really nice job with the press conference last week and acted like she'd been there a long time, delivering a good message. So good job for you.
Thank you.
This
Thanks
is
very
Mary
much.
Ann.
Appreciate it.
Look forward to hearing more.
Thanks. All right. The other item that's in your packet that's informational is, say this right, Fund 107 Emergency Preparedness Contact Tracing Grant Fund Amendment. This one? Anybody have any questions or concerns? Hannah? I'm not answering questions. Go ahead.
Couple questions. One comment first. I think this should have been an action item. Obviously, we could not do that this evening and take action, but it's an amendment to the budget. And I think the Board of Health those should be action items for our agendas. So I'd ask that in the future that they be put on as action items.
I think it probably will be an action item next month. No,
Okay.
Susan says no, Carla. We told you this before.
And so.
Go ahead, Susan.
I just kind of want to address what Hannah said. Yeah, I kind of agree with Hannah on that. This kind of should be an action item when we have budget amendments, I think, for the Board of Health, so that then the next Health Committee meeting, that it would be approved at the Health Committee. Otherwise, now we're going to have the Health Committee approve this before the Board of Health really approved it. So
okay.
I think we have to make sure we get our timing correct on that. I think, is that what you're asking for, Hannah? Yes, it's a budget amendment, and it should be formally approved by the Board of Health as the first step. And then obviously it follows through with the committees, county board, and then ultimately county board itself. So I wouldn't stop or hold up anything this evening. I think, I don't object to it going forward, but just ask that in the future that we handle those that way. And I do have a question about it, but I can wait if there's
Oh,
any
go
other.
ahead. Go ahead, Hannah, and then we'll do Judy.
Okay, I saw Judy, so I didn't know if she was, okay. So my question is just to clarify, couple. One, it looks like we approved a contract template for a contact tracer coordinator, I think, a couple months ago. And I noticed in the amendment that there's a subtraction for contract. So it looks like what we're doing here is saying we think this should be an employee as opposed to somebody we contract with because we may have long-term need. I'm guessing. So maybe you could give us some explanation and clarification on that, Jessica. So did we not fill that contract position, or is this person actually that person who's now going to become an employee?
Nope, you got it exactly right. So the grant ends in May, and so we're looking ahead now, expecting that COVID is going to go longer, and assessing the contractual positions that we have, the personnel that we have that we may need long-term, and start getting that process moving forward.
Great, because that was actually my next question was, I know we have the call center people are contract, and then there were contact tracers under contracts, and that all those, in fact, the one this evening I was going to ask about ends on May 31st. So, and obviously that would be wonderful if we knew we were done on May 31st.
Wouldn't it? Yeah, so it's highly doubtful, but I don't know now. I don't know yet even if there will be an extension for the funding or what that looks like, but we're starting the assessments of, looking at where we are right now, what would we need past May, and what do we need to start getting in place now to move forward past May.
So another question, does this involve an addition of an FTE somewhere along the way then to make this create a new position? And secondly, it looks like it's only an $18,000 increase. Is this going to still be a full-time position and we just needed, and is that money from the grant? So maybe.
Yes, yeah, so it's just the money from the grant. So it's not for a full year amendment. So Fund 107 is actually the contact tracing grant, and is one of the revenues in that. So this is just the revenue associated with that grant. If we were going past May, then we would have to amend a different portion of the budget.
Okay, so that the 18 is from the grant.
Yes.
And have we done, I can't remember whether we've done any budget amendments to reflect the grant monies at this point?
Right, so for 2020, we did one probably in August, maybe, I think, July or August. We did one for 2020, and then 2021, we just accounted for it when we did the budget.
Okay, all right.
Judy?
I guess a question for Susan. Susan, do you think it's going to make a difference if in fact the board had not formally approved this when you have your health committee meeting? And would it make sense if we could, at least in an advisory capacity, concur with this for you tonight? I just simply wouldn't want this to become an issue at the health committee.
That would be fine. If like Hannah said, she's not going to hold everything up to get this move through. If everybody agrees, then let's go ahead and do it.
Items first and then action items the next month.
Not necessarily.
Going forward after this, then we can make sure that we try to have the things done at Board of Health before they go to Health Committee. I can explain that at Health Committee.
Yeah.
If this board approves that
And
or agree.
how should we do that? You're suggesting advisory, take a vote, what's going to work for you?
You can't take a vote, but if I can have everybody concur that we want to move this forward, and then try and work on it better for the future, I think that would be fine.
Is there anyone that would not concur with that? All right. Carry it with hugs and kisses to the health committee.
Yeah.
And I think along the same vein, I'm guessing that, and I think I did not get the answer whether or not this also involves the addition of FTEs. It would probably, I would think so, since these are people who are working, they're not existing staff.
Yeah, I'll have to check on that and get an answer for you. It's temporary staff, so I'll have to get an answer about whether we'll have to do a FTE amendment as well.
I think that would be good because we probably would need to do that. And I assume that this will be coming up either in March or April then, as we near the end of the March 31st or May 31st deadline, as to whether or not we see other positions that should be made staff positions as opposed to contracted. So I would think we'd need to do an FTE amendment to reflect the positions, even as temporary. I think that's all the questions I have on that.
I'll stay up here because I think the next thing.
Yeah, and I just think, when
Stay.
I talked to Kathy Dry, I don't think we need to do a budget. I'll check with Kathy Dry again, because I
About the FTE.
think that we don't need to do a budget, FTE when they're temporary. All right, Corey, if you could talk to us just briefly about
Wait.
yours and Judy, you can't, oh, sorry, Susan.
I just want to clarify then what Hannah is asking, and I guess basically the whole process here, because we're actually just doing the budget amendment now, but we're not making the position, or we're not making the FTE until later. Is that correct? I want to make sure, because if it comes to health committee, like the last one did, granted we're doing this budget amendment, but then if it comes to health committee with an FTE and the budget amendment, I want to make sure that everybody's okay with that. Or do we want to, is it going to not have the FTE amendment until the April meeting? I guess that's my question.
I'm not sure if it needs an FTE amendment.
Well,
If it's
okay, so wait a minute, I had talked with Kathy Dreyer about because we're trying to ramp up some more vaccination personnel, and they're all going to be temporary workers, and you don't necessarily need, she said if they're temporary workers, you don't need I'm pretty sure she told me we didn't need an FTE amendment. But I will check with her again tomorrow, because I'm going to be talking with her in HR just to be sure.
Carla, I assume those same people, and that was a question I had on that other grant, but are more like what we're doing with the contact tracers and the call center folks now. We're considering them independent contractors. They're not getting benefits through the county, et cetera, et cetera.
That is correct. Only if they go over 0.8 of an FTE.
But this position, the budget amendment that's in the packet shows fringes.
Yeah.
So this is a different position than those. So
Correct.
if we are bringing somebody on as an employee, then we should have an FTE.
Yes, and it is grant funded, so I don't know if that makes.
Lots of positions are grant funded and they are counted in our FTEs. I mean, a lot of the department positions are.
question has to be.
That doesn't change the number. I mean, that's just, we need to know how we pay for them, but we have an approved number of staff that are connected to the budget. I mean, it's complicated, there's contract workers, but.
Great. Judy, what were you going to say?
Oh, I think it sounds as if because they are temporary, that it isn't going to be necessary. So I appreciate that you're going to confirm that.
Right.
We don't know whether it is or is not an issue right now.
I'm sorry, I'm going to ask one more, but we are choosing to change this person. We have a contract worker arrangement now. And we are saying, no, we need to look at this as somebody who would bring on board as a staff person because we view this as a long-term problem. And it seems to me we either are doing one thing or the other. That's what the memo suggests. And I think that's, Jessica, what you said, is we're looking at shifting these people from being purely contract employees or workers to employees of the county. Am I understanding that correctly, or am I not understanding?
Yes, that's correct.
So I think we just need to get some clarification on it. None of us are the experts on it, but it seems to me this is a different position than what we've been doing thus far.
Okay.
Because sadly, we think we're going to have a long-term problem.
Yeah, it is sad. Judy, go ahead.
No, I don't want to beat this to death, but The memo does indicate that it's a temporary position while we assess the future. So I go back to the fact that right now we're dealing with the temporary. It may or may not ever become a permanent position, but we're saying we're going to bring on a temporary person as we assess our needs going forward.
Okay, I'll clarify with Kathy and with HR, Amy Baker, tomorrow when I talk to them. Okay? All right. Corey, if you could just give us an update on some great work you're doing with on minority education. And I know that I used the wrong word. It is marketing health equity.
Yes. Okay. And before I start, I just want to say to anyone listening, the conversation we just had kind of highlights the complications of living in this new COVID world where you're building everything as you're flying it and, making a road while you're driving down it. And I started to, so before I give my little report, I just wanted to say, I was going to kind of list like the amazing amount of pieces and parts of the jobs that everyone at the health department is now doing that is just COVID related. And that's on top of the regular work that was always there as part of the multiple departments of the health department that keep the community safe and healthy, and the environment safe and healthy. And I decided I don't have time to read the list, but it just this budget thing highlights how confusing it is because there's so much newness and unpredictability about everything the staff, Jessica and her staff are dealing with. Everything from, the technology systems, the budgeting processes, the material and supply chain, the scheduling, the communication systems, the reporting and data tracking, the new partnerships and collaborations, the hiring new staff, interviewing, hiring, training, supervising new staff, everything related to everyone keeping abreast of the constantly changing regulations, and always keeping a handle on the pulse of the needs and trying to meet them. So I just want to say, Jessica and the staff have been operating at full throttle for now 1 full year. And they are rising to this momentous occasion over and over and over. I applaud their tenacity, the earnest effort they apply to meeting each demand, the continuous improvement and collaborative problem-solving mindset they apply to the challenges, and the open-mindedness and empathy they model. And we know there have been frustrations in dealing with all this, but I just can't say enough that you, as a community, you can rest assured that you have people here at the health department, led by Jessica, that are giving their very best every single day. So I just want to thank them. Okay. And now I'm going to give my little report. Okay. So if you remember, the original charge of this committee was to develop a plan for marketing information about 211, the PATH 211 support hotline, because we were aware in our community that there was an increasing demand for mental health and substance use supports. And we wanted to make sure that everyone in our county community knew that they could, with one phone call, they could start into seeking and getting help for that process, and that PATH would be able to direct them to wherever they needed to go. So that was our mission initially. So, and we started with the work that a smaller committee had begun, and that was with Chestnut, Project Oz, PATH, and United Way people. And then we decided we were just going to amplify that by creating a larger marketing campaign. And that was going to be, the blitz, social media, media public outlets, signage on buses, yard signs, electronic billboards, posting it all over social media, websites, newsletters, etc. And as we started down that path, because as everything has, the pandemic altered our direction, And in our ongoing communication with Karen Zangerly and Kevin Richardson at PATH, we learned that the number of calls there was increasing, not surprisingly, every month, and in some areas continues to increase every single month. And so we were fearful that if we set in motion an aggressive marketing campaign, that we might create a demand that could not be met. And so, but yet we knew if the demand was there, we needed to do something about that. So we have kept in very close contact with PATH, and they let us know all the time because, again, they serve so many important roles for this community. And I just want to say at this time, PATH continues to indicate that they have the capacity to meet the continuing increase in call volume. But, and this is the important part to hear, they stress that people may need to wait a little longer on the phones after they dial 211 in case the lines are tied up at that time. So just as we're asking you on everything, be patient and, don't give up, just wait on the line a bit longer. And we also want to reiterate that the health department has a COVID call center specifically set up to respond to COVID-related questions. But PATH, as you would guess, is also getting lots of those phone calls. And part of that is because sometimes national news outlets have said to call PATH to get COVID-related information. In fact, they've had a 55% increase in vaccine-related calls from December of 20 to January of 21. So we encourage you, although our call center is also having, lots of trouble keeping up with the demands of the COVID calls, and we're adding new people who are answering the phones, and we're adding more phones, but the demand is huge. And so just know, I guess the final message is that, please, we want very much for people to call PATH 211 whenever there is a need for help and for really any reason, but particularly for mental health, substance use, just fear, anxiety, depression, just, needing answers for support. And we can all attest that everyone's doing their best to keep up with that demand. So at this point, because of what we were also hearing from really all around the community and from our stakeholders, that we also knew that it was time to be ready to address any vaccination hesitancy that might be occurring on the part of anyone in our community, but most particularly our community members from the African American community and the Hispanic community, because of historical things that have happened. They have some pretty darn good reason to be a bit, hesitant to, or a bit distrustful maybe of their part in getting vaccinations. So we immediately wanted to dispel any of the myths around vaccination hesitancy. And so we have been, we've added to our marketing outreach health equity group, and we now have Arlene Jose, who is the chair of the NAACP Health Committee. And we have Socorro Alvarez, who is the Hispanic Outreach Director for Western Avenue. Tony Jones, who is a community leader and things like 100 Black Men and many other things. And we also have other members of the NAACP Health Committee on this group, and obviously Judy Buchanan, myself, and we're very happy that Marianne Manco, our new public affairs coordinator, is now part of this team. And the group expands from time periodically, depending on what we're working on. And so we've also had Reverend Dr. Bridget Black, who is from Wayman African Episcopal Church, and she also represents the African American Ministerial Alliance of Bloomington Normal. So, and there's been other people as well. So we have a group that has been very diligently working toward how to get information to the community the best possible information and easy to digest. And so we have now confirmed that there will be a virtual town hall to address vaccine hesitancy and just issues and answers. And that is going to be on February 22nd at 5:30. And there's going to be media information coming out very soon. It's going to offer both a formal presentation from a doctor who is a immunologist and allergist, and he's going to really speak to how the vaccine works and why it is safe to put into your body. And then Judy, if you want to talk about, do you have in front of you the list of the other local doctors? Do you want to mention the local doctors? Or do you want me to just go ahead?
No, I think I don't have the list, but we will have information sent out to the entire board. I think the noble thing, as Corey's been explaining, are the physician she just described, the immunologist is from out of the area, but we do have 5 or 6 local physicians who are doctors of color. And that was the message we received very strong from the community we spoke to. They wanted to hear someone that looked like them. So I think really neat thing is we've got this OBGYN, pediatrics, and OBGYN as well. So I think look at but those are the people that will be taking questions. And we're expecting it to be very helpful with the hesitancy issue.
And we have everything from OBGYN to pediatricians to family medicine and internal medicine, et cetera, advanced women's healthcare. So I think we've got a good roster there. So the other thing that we have not necessarily been doing, but we are very happy that has been done, that it's going to be able to inform things, activities, and projects we will do going forward, is that Amy Howe, who is the COVID-19 resource coordinator for the department, and Samantha Maynard, who is the Illinois Public Health Association AmeriCorps member, they have created and sent out a survey to a diverse group of stakeholders, and the survey is asking questions about, seeks response to questions about barriers and concerns related to vaccine hesitancy, contact tracing, et cetera. And so we are very much looking forward to getting the results of that. And the survey also seeks to identify the most effective and most appropriate means of providing culturally appropriate information and messaging to different groups. And again, we believe that will help us as a department move forward. And I can't say enough about how fruitful this partnership has been with this group of people I named earlier. And I believe that there's going to be many opportunities to address health equity concerns in this continued collaborative efforts among the Health Department, NAACP Health Committee, African American Ministerial Alliance, Western Avenue Community Center, and along with the myriad other agencies that the Health Department has long collaborated with. So we will keep moving this forward and help make the community as educated as they can be about this. Thank you.
Thank you. Both of you, Judy and Corey, I really appreciate what you're doing with the minority community, because that is so incredibly important to help the community understand the process. I had students asking me some really interesting questions yesterday. We were doing a clinic and these are nursing students but they, there's that lack of trust in the system, and there's a lack of trust in government. And so it's really important that we get the word out and that we talk. That's why when I say you guys should be vaccine ambassadors, when you're talking with your, friends and neighbors, chat up the vaccines, because it really was a safe process. Susan.
Yeah, I have a question for Corey on this. The FQHC is on the west side, where a lot of the low income and minority residents do reside. And I have not heard anything about how they are targeting their population and what kind of outreach they have done to that population. And I know that they can give vaccines, and I don't know what they have done. So have you engaged with them? Because I'm assuming because of their location that some of this population that you're looking at to work with and help educate are their clients, and to find out what kind of outreach they have done also, and to see what they're doing in that vaccination arena, and if they've even encountered some of the issues, the hesitancy and things like that in that population, because that's what their function is as an FQHC, is to serve the underserved population.
I do not know the answer to all of those questions, but I do know that they have done some vaccination clinics, and I believe they have, I think that it's been set up for 2 nurses at a time, and they do quite a number. They set them up for multiple people to be done in a multiple hour kind of clinic. But I do not know how those clients were selected. So I think all of those questions are excellent, and we certainly are wanting to work with both the Chestnut, the federally qualified healthcare center, and then also the community healthcare clinic. And I did learn from the community healthcare clinic that they are in the process of trying to be approved as a vaccination site, but are not yet. So, but your questions about Chestnut are very, we definitely need to get answers to all of those very important questions.
Any other questions or comments? Thank you so much. I really appreciate what you guys are doing. In your packet, there is a spreadsheet for the mass vaccination funding from IDPH. It's a grant that Jessica applied for, and it was due on Friday. Any questions? Yes, Hannah.
Just a question, and I think you may have answered this earlier, Carla, but it seems like a large part of the grant is going to go towards personnel, which is not unusual. I'm assuming that is, like, as you said, maybe hiring people to be available to administer vaccines. And the second question I have, and this for future, I would really appreciate if we could get some sort of just a very quick and dirty, here's the grants we've gotten, here's how much, because I get confused between the cures, the cares, and this is a new grant, and what parts of our operation they're funding, just so that we have a good picture of that. But maybe the next month or two, nothing urgent on that. But can you explain how we're the personnel part of that, Jessica?
Sure, and clarification, the grants, do you want to see all of the grants, or just the ones related to COVID?
The COVID grant.
Okay.
Yeah,
we're up 4, I think now. Yeah, so it's great to have money, but 4 of them now.
And I, echoing what Corey said, kudos to you guys for managing all these millions of grants and people and data and everything else.
So the application included funds, and it's for some temporary staff, so temporary vaccinators, and temporary help with scheduling for clinics, helping to build those schedules, because it's a pretty labor-intensive process. Temporary help with logistics, so helping manage supplies for all the clinics, and then also some temporary help just at the clinics. So, the people that greet you and check you in. So some temporary help for all clinic positions, and then also covering some of our regular staff, the nurses that are working the vaccination clinics.
You guys may not realize this, but it takes between 20 and 25 people to vaccinate 300 people in 3 hours. Because you not only do you have the vaccinators, people actually doing the vaccination, then you also have, like she said, people who are checking people in, making sure they're eligible, giving them the paperwork. Then you need somebody directing traffic so that they get from the check-in spot and are socially distanced into the area where they're getting vaccinated. And then you have to have 1 or 2 people who are watching them for 15 minutes afterwards and then doing the checkout procedure. So, I mean, even in the ISU small clinics, the most we vaccinate is 300 people in the afternoon, but I counted yesterday when we were doing it. There were 20 people there and only 12 of them were vaccinators. Susan.
Yeah, I have a question on the vaccinators. Because I've been hearing about that vaccinators just can't be any nurse that can give shots. Like if you go to the doctor's office and a nurse will just give you a shot kind of thing if you need one, or give your child one. But that there's hoops that we have to jump through to get vaccinators. And I don't know if that's true or not, but that's what I've heard. And if you could verify or deny or anything like that, the rumors on that.
Yeah, I'm not aware of anything. I can definitely check into it. Other than, if we're having volunteer nurses, so nurses that are not paid, not hired, then they would need to go through the Illinois Helps and sign up as an MRC volunteer. But I don't know about, are you meaning for their licensing or?
They probably have to be licensed, Susan, as an RN or an L.
Yeah, I guess that there was, I've heard various things on hoops people supposedly have to jump through, so.
I haven't heard anything, but I'll definitely check into it.
Yeah, mostly, if you guys know people who want to help with the vaccination clinics, there's a Medical Reserve Corps link on the health department website. It's a 1-page application. I did it. That's why I know about it. It's a 1-page application. It's not overly intrusive. You might have to they might do a background check if it's, if they need to do it for whatever the purpose is. And you don't have to be a medical person. If you're in, if you've got some people who want to help out with the clinics and they could, do the checking in, especially if they're, bilingual, checking in, helping people get to where they need to go, you probably need somebody with a little medical background to watch for some of the, for any of the reactions, because we have been giving medication. So that's something you'd have to have standing orders for. And you'd have to have someone with a medical license to do that. Sonia, go ahead.
I was going to say, having gone through that process a week or so ago, it could not work better. I'm just so impressed with how easily I was able to get through. Getting the appointment is the big trick, but moving through all the steps went very well. And every week it seems like we've added a new service. And I was there this past week with a couple that were kind of conditioned to think this was going to be really hard. And they were amazed. It was so easy. And at the end of the time when they were sitting waiting the 15 minutes before they could go, someone came up with a tablet and said, "Can I help you make your next appointment?" Which was also very, very reassuring. So that was a good step. So people are getting support. Now they were in the section upstairs where people have some disabilities. And so one of the group is in a wheelchair. But that's a great service. So I just want to say thank you, Jessica, and your whole team for continuing to add to that service and make it go well for people. Everybody helping get on the elevators and up and down. It just works very slick. Thank you.
Staff has definitely worked very, very hard, and the running of the vaccine clinic has been probably the easier part of this. The uncertainty from week to week of how much vaccine we're going to get, the process of scheduling has definitely been, that's our learning curve. The giving the vaccine, that's what we know we do.
Right.
Anyone else?
Very good.
All right. We'll move on to committee reports then. Behavioral health, thank you, Jessica. Behavioral Health Coordinating Council.
We haven't formally met, but we are continuing to hold virtual seminars. And so there was one a week or so ago that was very good. So if you all are at all interested, you need to look this up and sign in and get to the sessions. They're well done.
Excellent. Thank you.
Yeah.
Okay, so
Adolescents and their issues.
yeah, perfect. So do you Google Behavioral Health Coordinating Council to get to the information on it?
You could, I think the county, I'll make sure that you all know, so it's sent out to the board. How's that?
Okay, that'd be great. I really appreciate that. Thank you. Mental Health Advisory Board, Corey?
We meet quarterly, and so our first meeting for 2021 will be February 22nd, I believe. Is that right? Yeah, pretty sure. Okay.
Thank you. Susan, County Board?
I don't really have a lot to say. County board. We have our full board meeting tomorrow, and I might hold comments for when Jessica gives her report.
Okay. Behavioral Health Policy and Funding Committee, Hannah?
Thanks, Carla. We have not met. We are scheduled to meet March 26th to sort of get back into the groove, as it were. I'd ask anybody who has anything they'd like us to consider. I mean, we have some recurring questions and issues that hopefully this year we'll kind of work our way through in terms of how we structure the grant proposal process. But if anybody has any thoughts on things they'd like us to consider in terms of how we handle that, please forward those to me. I guess we probably won't have a report them for you until April meeting, because we will meet after our board meeting next month.
Thank you so much. And now, administrator's report. There are several items in your packet.
Yeah, my report started on page 11. Are there any questions?
Very good. Good.
I just have a question, and that is if Jessica, you would just maybe, I know you, maybe the point about, other than the health department, there are also lots of other entities that are doing vaccinations throughout our community. And some of them you are supplying vaccine for, some of them you are not, correct? And so I just want the public to know that the health department, I mean, this is a community effort, and it can only be met by a community effort, because the numbers who need to be vaccinated are in the, as you all know, in the thousands. So I don't, and I would also say, if any partnerships you want to highlight that have made things go well because of that you've partnered with people or are planning to partner with people to go forward.
Yeah, as you mentioned, you know, we do the allocations that come into the county for vaccine a week. They're going out. They're not only the health department and you know, our partnership with Carl. We're running 4 clinics usually a week. So they're not going only to supply that. They're going out to, I think, about 7 different partners that we're allocating as much as we can to them. So some of them are helping us with educators. So scheduling clinics with our schools to go to the schools and get the educators and staff and faculty there vaccinated. We've got some that we're helping with homes, the Scylla homes. And so, I mean, we have lots of partners that are helping out. And obviously, you know, we have OSF that are helping out. They're reaching out to their clients age 65 and plus. And so we're providing them with vaccine as well. And then another local primary care provider's office that we're providing vaccine to. So really the limiting vaccine is limiting what we can do just as a community group, all of these providers, all of us together. But yeah, we're definitely trying to get as much out there because we cannot vaccinate the health department as much as we want to. We can't do it on our own. So we do thank all of our partners for helping us out with this.
Bob.
I'd like to just amplify what Corey had said before, Jessica, that I've had numerous compliments to the process, very, very positive. And I think what's amazing is that the adjustments, to get the appointments is the hardest part, but you are adjusting constantly, improving the communications and the website. And I think that's just amazing, and make sure that your staff know that they're doing an amazing job. Thank you.
Yeah. Susan.
I've had several conversations with Ms. McKnight about this, but one of the things that we county board members have contacted me along with constituents on the disparities on vaccine allocations amongst counties. And Ms. McKnight and I have had numerous conversations about that. And I've reached out to Senator Barrickman and hoping he will help get some answers for us on that. And it's not really a question for Ms. McKnight, although she can weigh in on this. I'm kind of disappointed in the state again, because this afternoon they announced that they are now going to have Walmart and Meijer as more federal partners, and there was something else too. Oh, I know. And then it's almost that some counties have a lot more vaccine than we do, and they're basically saying on the 25th of this month that there's going to be changes to who's eligible in 1B. And I think that it's going to be a challenge for us to then move forward with adding more people to 1B. And I think that it's like I said, this is not anything against Ms. McKnight, but I think she's going to be much more challenged, even more than she is today, on trying to accommodate an increase in population that can be eligible for vaccination when we aren't getting any more vaccines. And so I'm quite concerned about that at this point, knowing, like I said, other county board members have contacted me, constituents have contacted me, their constituents have contacted them. It's constant. And I don't see this getting better right now. It's almost like, why is the state just basically pretty much opening up to say anybody can get one? And so it's a real concern when we're not getting enough vaccines to even, deal with what we have and the competition, I guess, to try and even get an appointment, because so many people are wanting it even now. So I guess that's kind of like more of a statement. And if Ms. McKnight would like to say anything about that, that'd be fine. But I'm sure she probably feels the same way I do about it.
Yeah, it's definitely a frustrating situation, and the just uncertainty from week to week on how much vaccine we're going to get, when we're going to get it. I know the state's hands are tied as well, because it comes to them from the federal government. It makes it very difficult for us to be able to plan further than a couple days, and even then, you're hoping that you get the vaccine that you have appointment scheduled for the next week, and that doesn't even go to say for the thousands that we need to be able to vaccinate and we don't have the vaccine for. So the announcement of 1B being expanded today was news to me as well. So.
Judy.
Yeah, I just, not a question, but certainly a comment. I think it behooves us as board members. We can be excellent ambassadors. Jessica and her team, as has been noted, are doing a phenomenal job, and they're planning and doing everything that they can. As I've told people, we are ready to go. We have the physical amenities we need. We just don't have the vaccine. And I continue to preach the message of patience. But I wanted to remind you that the daily updates that Jessica releases, as well as now some additional press releases that go out now that Mary Ann's on board, there's a lot of information in that. And sometimes I even highlight it and send it out to people that I know in an effort to spread that word. So I do have a question, Jessica, about press release. Those that I've seen, some that are attached to your daily update. There are others that go out though that may have come later in the day. Is the board, the Board of Health members copied on all of those?
Yes, so we sent out a couple, as we said, we would announce if we know we're able to open up additional clinics or additional appointments based on knowing we're getting more vaccine. We'll put out a press release, give the media time to cover that so the public knows that those are coming. And you guys are on that media list, so you get it whenever any press releases, when they go to the media, they go to the Board of Health as well.
Very good, thank you, because I think they do give us the information we need, and they're very helpful. And I see the media picking up on providing more information in the various sources. So we just have to continue to get our information and share it. Thank you.
Thank you, Judy. Sonia? Oop.
I was going to add, I had shared this just a little bit earlier this afternoon with Carla. There's a United Way group of women called Women United, and we're looking to bring together a few people to help with the calls that are needing to be made. And I know you've got a call center and you've got people hired to do that, but these are people that can volunteer to also take a list and make calls, especially if something has to be rescheduled. So who do they talk to arrange that?
Yeah, so they have reached out to me today, so this afternoon. So that connection has been made, and now it falls in my court to make that connection and figure out where we can get them to help us out.
Yes. Yeah. Many hands make light work, but it also makes major work for the person coordinating the many hands. So we appreciate all you're having to do with that. Thank you.
Bob, did you want to say something? Did you have a comment? Okay, you moved your head and I was out of the corner of my eyes. I just want to be sure I didn't miss anybody. Does anybody else have any more questions for Jessica? Other than a standing ovation? Okay, so our action item is approval of a call center supervisor contract, which is in your packet beginning on page 18, 19, and 20. Do I hear a motion?
I'm happy to move approval to get this on the table for discussion.
Okay, is there a second? Second, Judy. All right, discussion. Sonia, do you have something? Did you want to start the discussion? No.
No, I think it's a good move because that's a really, really growing, very busy area, and it will be very helpful to have that position identified and the roles described. So thank you.
Anyone? Hannah?
And just following up with the earlier discussion, this contract will only take us through the end of May. So it's fairly short term right now. So I'm going to believe that we're going to need a call center in these positions for a longer period of time. So will we see like we see with the contact tracer coming our way, which would make this an actual county position?
What was the question?
Will there be contact tracer positions coming our way to make these more formalized, right? Is that your?
This
You cut
contract,
out a little bit, Hannah, so that's why I'm clarifying.
The contract will, as written, and all these are all set up to end on May 31st. So we'll either need to renew them all, probably if we get an extension of our grant. But as with the contact tracer position, I assume this could be one where we might be looking at converting it into a county position.
Yes, if needs, yes.
Tammy, go ahead.
With Jessica's blessing, I would like to possibly at the next Board of Health meeting, submit a plan for what it might look like for long-term if we don't get additional funding.
That'd be great, Tammy. I assume that's okay with you.
Oh, yeah, yes. We've talked about and started that conversation of May is just right around the corner. Time has gone so fast, and we're anticipating that COVID will extend past May. The expectations of what we're going to need to do will extend past May, and there has not been any notification of additional funding. So rather than wait until May, start that plan, and this is what we would need.
Good. That's great, Tammy. We'd really appreciate that, and I'll be sure and get it on the agenda for next month.
Good.
Yes, Hannah.
Just following up with Tammy's offer. So would this include all the positions that are currently COVID grant funded?
It probably wouldn't include all of them. We'd need to assess what do we need. So yeah, because right now we've got 50 plus just tracers, and what would we need to sustain efforts in both the call center and tracing.
That would be, I think we need to do that. That'd be good.
Thank you so much, Tammy. Corey.
I'm just wondering, have we solved that now that, we've got more people doing at the call center and a call center supervisor? Do we have enough phones? I imagine you were literally running around pulling every phone you could find anywhere in the bowels of the building.
Well, yeah, we're still looking at possibly continue to expand that, but we're working with IT because there are other issues besides just the physical phones. So the phone lines and the support that we had there. So we've been working with county IT to make sure we have what we need in place to sustain the call volume that we're receiving.
Is there any other discussion of the motion, Susan?
Well, I guess it's a question about the call center. So I've heard, have had complaints about it disconnects. Is that intentional? And people have been on hold for a long time. I mean, this is not about the call center supervisor, but it's about the call center. People have been on hold for a long time and then it disconnects. Is that intentional? Like when you mentioned how IDPH's site, when you go into that virtual room, that's the way it was designed? Or is that a problem just because we're having too many calls at one time, and that the system can't handle, thousands and thousands of people calling at the same time? I guess if you could clarify that, please.
Yeah, so as I mentioned, we're working with county IT, and so if that is still occurring, I want to know, but there are only so many people that can answer the phones. So individuals the phone may ring, but they should not be getting disconnected now. And same way with, I know there was, a voicemail that was set up that was full. Again, that is no longer in operation. So we've made changes to adjust to be able to have the call center be operational as we need.
Hannah?
Yeah, again, following up on Susan's question, I had heard that somebody called before it was open, and it went to a person who'd worked for years ago to their voicemail. So I assume we've caught that, and when you called before, hours, it'll just tell you when to call back.
Yep. So we've made the changes to not have the voicemail and to have it, because that was definitely an issue.
Tammy, okay. I didn't know if you wanted to say something.
I was just going to comment about the what should be happening, what we've told happens when you call, is that you get a message loop. So you hear the original message, this is who you've reached, then you kind of go on hold. I'm not sure of the time frame that you go on hold, but then you hear the message again. I mean, we've all called places like that where they keep repeating the message. But like Jessica said, we'll check into the disconnecting issue if that's still happening. I know it was in the beginning, but I thought it was fixed.
Yes, Sonia.
Any thought at all about expanding the hours for people that are working during the day and trying to make phone calls after hours or weekends or anything?
Yes, yeah, that we've definitely intended for that to be the case, of the call center going longer than just our operational hours. So it's something that is in future plans.
Okay. Down the road.
Mm-hmm.
Okay. Lots of things to keep track of down the road.
Tammy, did you want to say something? Did you want to add anything? You sure? Okay.
No, thanks.
Just checking. All right, we have a motion on the table. It's approval of the call center supervisor contract.
Hannah.
I assume there's no more questions about the actual contract in the motion.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Robert Colhase,
Yes.
Scott Hume. I think that was a yes.
Yeah.
Sonia Reese
Yes.
and Susan Schaefer.
Yes.
Great, thank you so much. Motion passes unanimously. Are there any other items for the good of the order?
Yes, Carla.
Yes, sir.
I know that last month we didn't have an opportunity to talk about Mr. Anderson's submittal, and I think, all things COVID today, I think if he's willing just to highlight a couple points of the impact of the pandemic that he outlines in his report, but I think it's significant to say publicly that there's a chain reaction of events that goes on, and we focused on the vaccines and the call centers. But there's other aspects that he's managing that's impacting that department. And Tom, if you're there, if you could just highlight a couple of things so that we hear publicly what some of the outfall is from the pandemic and some of the things you're adjusting to. And not there. I just want to highlight that report is in there, that it does impact the staffing time and helping out on the different vaccination pods and doing other things and changing the licensing and the education going on. So I just want to highlight that so that it's a part of the record.
Thank you, Bob. I know that his department has been impacted quite a bit just in terms of fielding, complaints from citizens about, different COVID violations. So, mask wearing and those type of things. So thank you for highlighting that. And he's still carrying on and doing restaurant inspections. Their training has been postponed for a little bit, but they've still got to do a lot of their normal tasks. So thank you for highlighting that. I appreciate that. Anyone else? Hearing no other comments or concerns, do I hear a motion for adjournment? Judy and Sonia's a second, and I assume everybody is in favor of adjourning. You don't have to call the roll. All right, everybody.
Carla, thank you for your leadership through this time.
Oh, you're welcome.
You have, I know from the notes that we get that you have lots of connections that you have to keep up with besides that thing we call your day job. So we appreciate that.
Well, thank you. I appreciate that too. So this weekend, everyone knows it's going to be excessively cold with really severe wind chills. So this is your public health message from your local public health nurse. Be sure that I'm a public health nurse. So be sure that you cover your nose and mouth. Watch, it's going to take 10, 15 minutes for you to start getting frostbite. So don't go out unless you have to. Double up your layers. Be sure you've got something over your mouth so that you're breathing in moist air. And don't go outside. Tammy, hang on, Tammy. Go ahead.
Can I just add, since you're talking about how dangerous the weather will be, Connect Transit continues to partner with us in providing a warming bus. They park in the health department parking lot for anyone who's waiting on a bus. Just this week, I actually handed that task off to Kathy Beck at EMA. She had been talking with them also, and I said, well, we both shouldn't be talking with them. So EMA is now making sure that a warming bus and a cooling bus in the summer is available to our community members who use public transportation.
Excellent. Excellent. Thank you so much. Corey.
I just wanted to make sure I did not leave the impression that you should be calling 211 about COVID issues. They certainly will do their best to help if you do call there, but that is not their function. And so I wanted to make sure I did not leave that impression, but certainly call them for support with behavioral health, mental health, substance use, depression, sadness, fear, loneliness, all of those things. If they're getting to you, we really want. We know this is a very hard time for people. The pandemic has clearly become so invasive in all parts of our life, and it is very hard to keep rising above it. So if you are stressed, please use PATH to get you to the supports that will be helpful to you.
Great. Thank you so much, Corey. All right, then. Anyone else? You all have a good week. Stay safe, stay warm. And thank you for your service. I appreciate it.
Good night, everybody.
Good night.